Thank you, and good afternoon. The COVID-19 situation in Singapore has remained stable since the start of Phase 3 heightened alert, although we continue to see a steady stream of community cases as well as a handful of clusters each day. This suggests clearly that a certain level of unknown transmission continues to occur within the community. The Bukit Merah Market and Food Centre cluster continues to grow, and additional smaller clusters have emerged from that cluster too. Any of these new clusters can become another big cluster if we are not careful. We have intensified our contact tracing and testing efforts, and we aim to bring these clusters under control as soon as possible to prevent further transmission into the community. Due to the further easing of measures that commenced this week, including dining in, we expect cases to rise somewhat in the coming weeks. This is inevitable and a situation that we must be prepared for. However, if all of us can continue to abide strictly by the safe management measures in place and practice good personal hygiene habits, I'm confident that we will be able to continue to keep the situation under control. At the last press conference, we spoke about how higher vaccination rates will allow us to open up more quickly, ease border restrictions, and allow more community activities. As we have managed to bring forward our delivery of vaccine supplies, we will be able to accelerate our vaccination program significantly. Minister Ong Ye Kung will announce more details shortly. We are currently working out the roadmap and the timing to reopening based on vaccination rates, and we will share more details when we are ready. But we can provide a sense of what we can expect when the time comes. We will achieve a 50% full vaccination shortly. That means half our people will be protected. We expect the risk of infection and emergence of large clusters to be greatly reduced. But the other half has not yet been vaccinated, so we will still not be able to open up fully. Nevertheless, we hope we are able to allow the easing of some safe management measures in time to come. Come August, we expect about 2/3 would have been vaccinated and protected from serious illnesses. But 2/3 will still not be enough. We need to continue to press on with vaccination to achieve an even higher rate of coverage. Then we will be able to resume the higher risk activities which we have suspended over the last 1.5 years, maybe with some capacity limits imposed. With higher rates of vaccination, we will also be able to resume traveling. Those who have been vaccinated will be given some concession when traveling or returning to Singapore. For example, vaccinated travelers, including Singaporeans who travel overseas and returning to Singapore, may undergo more frequent testing in lieu of serving SHNs. We will also start allowing more workers, in particular our migrant workers and migrant domestic workers, to enter Singapore. This will ease the immense pressures our companies have been under since the start of the pandemic and allow store projects to restart, family members to reunite, and their migrant domestic workers to join them. As Singapore moves into a world where COVID is endemic, we will have to change the way we deal with it. We will not be able to eradicate the virus totally, and hence we will have to learn to live with it. There will be people infected every day, but as the vast majority of us have been vaccinated, we can keep it under control. And the key is to minimize the number of hospitalization and the number of serious cases. Instead of focusing on daily cases, we can focus on patients who are hospitalized or in the ICU. This is what many other countries are doing right now. Singaporeans may also have to get used to more self-testing using rapid test kits. If tested positive, the patient can go to a clinic and confirm the diagnosis with a PCR test. And if the patient has mild or no symptoms, the patient can isolate and recover at home and only go to a hospital if their condition worsens. All these are possible only when we have achieved a high level of vaccination. It has been a challenging 1.5 years for everyone, but the progress we are making on our vaccination program is the light at the end of the tunnel. Barring any unforeseen circumstances, we'll be able to open up quickly and decisively once we have achieved a high level of vaccination. To all of those who have signed up and taken your vaccination, thank you very much. Please encourage those around you who have not been vaccinated or have not signed up to consider doing so as soon as possible. In particular, I want to take this opportunity to once again urge the elderly to go for vaccination if you have not done so already. In the recent Bukit Merah and Red Hill clusters, we saw that seniors made up almost half of all the cases there. The good news was that more than half of those seniors had received at least one dose of the vaccination, and many are stable and recovering. If not, we could be seeing more dire consequences. So please take the vaccine to protect yourselves and your loved ones. If you have any concerns or any questions, do approach a medical professional or call our hotline 1-800-333-9999. 1-800-333-9999 if you have any questions, and we will address them and help you make a decision. So once again, thank you very much. Let me just say a few words in Mandarin. 疫苗接种计划进行顺利，卫生部打算加快步伐，以提早完成接种的工作。我们最关心的还是我们当中年长的一群，他们面对的风险最大，所以最需要接种疫苗。尤其是我们逐步开封之后，更是如此。我想在这里再一次呼吁我们的年长者，他们现在已经不需要预约，就可以直接前往我们的接种中心接受接种。最近红山的感染群中，半数是年长者。年长者如果有疑问的话，可以打我们的热线1800-333-9999，让我们为您解答你的疑问。所以还是请大家帮忙，让我们一起鼓励我们家中的年长者去接受接种，来保护他们。谢谢大家。Now I'd like to invite Director of Medical Services, Professor Kenneth Mak, to give a quick update.
Thank you very much, Mr. Gunn. As of the 24th of June, today, the Ministry of Health has preliminarily confirmed 14 new cases of locally transmitted COVID-19 infections. 12 are linked to previous cases, among whom 11 have already been placed on quarantine, and 1 was detected through surveillance. The remaining 2 cases are currently unlinked. Based on our investigation so far, all these cases are in the community, and there are no new cases in the dormitories. There are in addition 9 imported cases, all of whom have already been placed on stay-home notice upon arrival in Singapore. And of these, 4 are returning Singaporeans or Singapore permanent residents. So in total, there are 23 new cases of COVID-19 infection in Singapore today. There are several community clusters that we are monitoring, and we've found that there are some common links or common modes of transmission. They've initially spread in the workplace, and the workplace could be defined differently depending on the cluster. Some were F&B outlets, others were office settings, and we had seen a cluster involving delivery riders from a F&B outlet. There was then secondary spread that took place to households and involved close contacts in social settings as well. 3 of 10 large clusters will close by the end of June if there are no more cases detected within these clusters. And this includes the cluster that was found in Block 506, Hougang Avenue 8, as well as Chevy's Bar and Bistro. But our concern presently are the clusters in the Bukit Merah and Tiong Bahru area. And particularly for the 115 Bukit Merah View Market and Food Center, we know that the next case was a sundry store owner in the market, but has since spread to involve other stores, stall owners and tenants, and into several households and included social contacts. Patrons and visitors to the market and food center have also been involved. So as of the 23rd of June, there are 82 cases involved in this particular cluster, of which 36.7% of them were fully vaccinated and 51.1% not vaccinated. 46 of these cases were not household related, and 16 of these cases were detected from surveillance or community testing operations that we conducted. And 27 cases had been isolated or quarantined before detection. The Market and Food Centre remained closed until the 26th of June. Of the cases that were detected in relation to this cluster, nearly 47% were above the age of 60. There are other clusters in the vicinity that we continue to track as well, and that includes other clusters in the Tiong Bahru region. But we are awaiting phylogenetic study results before we can confirm whether there's linkage to this Bukit Merah View cluster. Our area of concern is identified as a result of these clusters that we have identified, but also supported by other tests conducted, for example, wastewater testing, that allows us to understand whether there might be cryptic chains of transmission occurring within the area. And they have allowed us to sharpen our strategies for heightening community surveillance through aggressive testing in the areas, and these areas include the enabling village, the Red Hill area, and we continue to extend these areas if necessary. We have conducted quite a number of tests over the last 3 weeks involving this aggressive community surveillance. And in short, at least 219,000 tests have been performed in various areas, in dormitories, in workplaces, and community, in order to pick up these cases. Overall, the community numbers have increased in the past week compared to the week before, but the proportion of unlinked cases has dropped from 25 in the week before to 21% in the past week. And of those linked, 46% were already in quarantine, while 33% were detected through surveillance in the past week. Our household transmission appears to be decreasing, and those that were detected on entry into quarantine has also further decreased, from 18.8% on the 16th of June to 5.5% on the 22nd. And this suggests that we are getting to our cases more quickly as a result of the aggressive testing that we've been doing. Yesterday, we reported 141 cases admitted into our hospitals, with 5 cases in the ICU. All 5 cases in the ICU were unvaccinated cases. And it reinforces our concern that those who are not vaccinated, if infected, may get more aggressive cause of disease, a more severe cause of disease, may require oxygen supplementation or even ICU care. And certainly in the Bukit Merah cluster that we've seen, even though there's a high proportion of seniors, those who have been vaccinated, of which there were 36.7%, as I mentioned earlier, the majority were either mildly symptomatic or asymptomatic. And this reinforces the call that we've been giving for all who have yet to be vaccinated to step forward and make a use of the opportunities that are coming up to register and be vaccinated. Our seniors in particular will be hard hit if the clusters increase, or if more clusters like that we see in Bukit Merah then break through in our community. Thank you.
Afternoon, everyone. My fellow co-chairs and I, we published an article today describing how we can transit to an endemic COVID situation. So Minister Gan has talked about it and described the salient points. I will not go over again. But the key to this transition is vaccination, and that will be my focus today. And we have reached a very critical stage of our national vaccination exercise. First, let me give some updates on progress of vaccination. As of 23rd of June, we have crossed 5 million doses administered. And more than 3 million people amongst our population have received at least 1 dose of the COVID-19 vaccine. And so this translates to about 53%, or over half of our local population having received at least 1 dose. As for those who have been fully vaccinated with 2 doses, that's 36% of our population now, over 1/3. For the various segments who have received at least 1 dose or have booked an appointment for vaccination, these are the percentages. Seniors above 60 years old, about 75%. But it's not enough. As Minister Gunn and Kenneth have both mentioned, it is really important for our seniors to get themselves vaccinated. So 75% is not enough. We hope more of them will come forward. 45 to 59 age group, 77%. 40 to 44 age group, 70%. 12 to 39 age group, which were open only recently, 2 weeks ago, 39%. But many have registered and waiting to make appointments or waiting to book appointments. I'll talk about that later. Students continue to see very encouraging response, and right now it's 83% and rising. So as we confirm our supply schedule, we are now confident that we can vaccinate more and faster. So this is what we are going to do. Number one, 80,000 doses a day. In May, we were administering about 40,000 doses a day. When we crossed into June, we pushed our limit and raised it to 47,000 doses a day for June. We will now ramp this up to 80,000 doses every day in the coming weeks, starting this weekend. Second, the first tranche of 500,000 slots will open in the coming days. In fact, starting Saturday and then in the coming days. I know many people have been waiting, especially those in the 12 to 39 age group. You have been waiting to book your appointments and you have registered your interest. I thank you for your patience. With this ramp up, we will be able to open up many more slots. So as I mentioned, we'll open up another 500,000 slots starting this coming Saturday, 26th of June, and you may receive your SMSs either today or tomorrow. So for eligible individuals who have registered for the first dose of vaccination but yet to receive a booking link, you can expect to receive an SMS to make an appointment from today or tomorrow. Third thing, we'll extend the priority for Singaporeans by 1 week. We had hoped to implement this ramp up earlier, but we were constrained by supply, but we are able to do it now. So in view of that, we will extend priority for Singapore citizens aged 12 to 39 years for another week to 1st July 2021. And so if you are Singaporean aged 12 to 39 and not vaccinated yet, please, before 1st July 2021, quickly register and book your appointment once you receive your SMS. After 1st July 2021, we will go on a first come, first served basis for the rest of the population. Fourth, we will start to bring forward second doses soon. We hope that supplies will continue to arrive and enable us to sustain this pace of 80,000 doses a day through July and then August. Then if we can do that, it means that sometime towards the second half of July, we would have substantively administered most, if not all, first doses to people who are willing to take it. So everyone who are willing and want to take the first dose, by second half of July, we should have administered them. Then we would have achieved our target of prioritizing first dose and giving some protection to as many people in our population as possible. Once we achieve that, it will not make sense to have people continue to wait 6 to 8 weeks until August or beyond for their second doses. So we should then reduce the waiting time between first and second doses back to 4 weeks. But I always qualify supply willing. This means we will at some point be inviting people to rebook your second dose appointment to earlier dates. If it's in August, we will invite you to rebook and bring it forward to July. And this will allow more of our population to complete their vaccination of 2 doses and then receive maximum protection earlier than previously. We are working out the details. Today we wouldn't announce them, but once we are ready, we will announce the details. Now, on the non-mRNA vaccines front, MOH has been looking out for vaccines that are of good quality, safe and effective to be part of our national vaccination program. We have signed an advance purchase agreement with Novavax in January this year. And recently there's been some results of Novavax clinical trials, encouraging results published in the papers. But the shipment will not be ready so soon because the vaccine is still undergoing phase 3 clinical trials. And we are working closely with Novavax and awaiting their application for regulatory approval. But we hope the vaccine supplies can arrive before the end of the year for those who want to take something that is non-mRNA. But in the meantime, please continue to consider mRNA vaccines. They work very well. Please consider them unless you are medically not eligible to take them, such as you are allergic to the first dose. Now that we switch to a higher gear for vaccination, we are raising our targets higher and realizing them earlier. In the Prime Minister's address on 31st of May, PM Lee announced that our target is to get 2/3 of our population vaccinated with at least the first dose by early July. And everyone who is eligible for vaccination should be able to get their first dose or first jab by National Day. Yeah. With our accelerated vaccination program, we can now raise this target to have 2/3 of our people fully vaccinated with 2 doses around National Day. And this is an ambitious target, but achievable. But I also have to qualify, while ambitious, it is another interim milestone. And in fact, we need to get more people fully vaccinated than this 2/3 milestone. So we need everyone to step up and get vaccinated. And then when the time comes, get your second dose appointment rebooked to an earlier date. If it's in August, rebook it to July, when the time comes. Of course, everything I said depends on supply arriving on time. We are operating on the JIT method, just in time, vaccinating as supplies arrive. So we hope supplies continue to come consistently, then we can vaccinate as fast as we can. But it involves some risk, but we'll do our best. The MTF will be drawing up a roadmap as we vaccinate faster and more to transit us towards normalcy, towards an endemic COVID-19 situation. But we are very mindful. This is a shape-shifting enemy, and it will continue to throw us surprises. It will continue to throw us surprises and curveballs. So while we draw up a roadmap, we must be prepared to adapt, to move forward, but sometimes reverse if we need to, and before we move forward again. But we are determined to see through this end game. Then we'll be able to put circuit breaker behind us, F&B and gym closures behind us, be able to have bigger events, be able to have bigger wedding receptions, and then overseas travel without SHN and quarantine. Let me now just repeat some of what I said in Mandarin. 这是我们接下来会做的事。第一，每天接种8万剂疫苗。我们每天的接种量，5月的时候是5万剂，6月的时候增加到4万7千剂。我们从这个周末开始会进一步的提高接种量，每天接种8万剂。第二，首批的50万个预约名额，接下来这个星期六开始就会开放。我知道有很多人其实还在等预约接种的机会，非常感谢大家的耐心等待。随着接种量的提高，我们现在可以开放给更多人预约。所以从这个星期六开始，就是6月26号， 我们开始开放，让50万人可以预约接种第1剂疫苗。那些符合资格也已经登记要接种第1剂疫苗的，你从明天开始会收到预约接种的短信。第三，我们会延长国人优先预约期多1个星期。我们其实在更早的时候就想加速提高接种量，但是我们受到疫苗供应的这个限制。我们现在可以这么做了，所以我们接下来会继续让12岁到39岁的公民有多1个星期的优先登记期，直到7月1日为止。所以如果你是12岁到39岁的公民，而且还没有接种冠状疫苗，请抓紧机会在7月1日之前去登记。我们之后会开放给其他人登记，是用先到先得的机制。第4就是提前接种第2剂疫苗。我们希望疫苗的供应会继续下去，让我们在7月、8月里维持每天8万剂的接种量。那我们到了7月份的下半个月就可以让绝大多数的人接种至少1剂疫苗。也就是说，我们会完成了我们的目标，尽量让最多的人有好的保护。到时候大家也不需要再等6到8个星期，等到8月或更迟才接种第2剂疫苗了。到时候你在接种第1剂之后，只要4个星期就可以接种第2剂了。当然，提前是前提了，是疫苗的供应要没有问题了。也就是说，那些现在还在等第2剂疫苗的人，我们会邀请你预约一个更早的时间去接种，7月就可以接种第2剂，不需要等到8月。这会让更多的人可以完成2剂疫苗的接种，尽快得到最大的保护。这些详情呢，我们的工作人员还在拟定，所以我们做好准备后会宣布更多的详情。谢谢大家。
Good afternoon. We had earlier mentioned that we could get at least half of our population fully vaccinated by August. But as you heard just now from my fellow co-chairs, with the bringing forward of vaccine supplies and speeding up of the process, we are now able to set a more ambitious target of at least 2/3 of our population fully vaccinated with 2 doses by National Day. It's an ambitious target, but supplies permitting, we will be able to achieve this. As we continue to ramp up our vaccination over the next few weeks, we will also plan on making several immediate moves. First is the next stage of our reopening, specifically to move from 2 persons to 5 persons for higher risk settings like F&B dining in. We had said earlier that we plan to do this sometime around mid-July. With the vaccine on track, with the regular testing of workers in these higher risk settings proceeding, we should be able to get there. Exactly when this will be, we will work out the dates and we will give some advance notice, but this is something we should be able to proceed on. Second, we will revise the public health guidelines for vaccinated persons. And this applies in 2 aspects. One, within Singapore itself, where it comes to activities and gatherings or events, we could allow gatherings involving just vaccinated persons to have larger group sizes and also relax the social distancing rules in such settings because only vaccinated persons are involved. So that's within Singapore. And this could apply to a whole range of different settings: religious services, concerts, sporting events, and so on. So that's one area of work that we are working on. Second would be travel. Potentially, we are working on some new guidelines for people in Singapore to be able to travel abroad. And then when you come back, you either can serve a shortened SHN, the quarantine time under the stay-home notice will be shorter, or may be waived entirely and replaced with some test. And this will depend on the country that you visit. Right, so these are the potentially revised guidelines that would apply to vaccinated persons. We are still working through them, and we will announce them when we are ready. At the end of the day, whether it is in Singapore or anywhere in the world, this is really a race between the virus and vaccination. And so it is of utmost importance, as everyone on the panel has already said, for us to get our vaccination rates up. We have been making steady progress, but we are watching very carefully the vaccination rates for the elderly group. As Minister Ong said just now, for those who are above 60, the vaccination rate is 75%, but in fact, there are two groups. The 60 to 69 vaccination rates are nearly 80%, not too bad, but for the above 70, it is not quite at 70% yet, it's lower. And that is, in fact, the more vulnerable group because they are older. So we still need to get vaccination rates for our elderly higher than where they are today. In fact, in some places, they have already achieved more than 90% vaccination coverage for the elderly population. So we still have some room to go. And as you heard just now, if you look at what happened recently in Bukit Merah, where there was a super spreader event, and many of the people who were infected were elderly persons. This can easily happen in any other part of Singapore because we know there's still underlying transmission, there are still unlinked cases. You cannot rule out the possibility that new clusters will emerge. In fact, this may very well happen. And it could happen in an area where there's a high concentration or a high proportion of elderly persons. And if many of them are not vaccinated, then we will end up with more severe consequences because they will have severe illness, hospitalization and ICU rates will go up, and unfortunately, under such a scenario, fatalities may rise too. So we must do everything we can to avoid such an outcome. And the best way to avoid it is once again to appeal to all our elderly persons in Singapore, all our seniors, get yourselves vaccinated. We have simplified the process for you to get vaccinated. You don't need to book in advance, just walk into a center and you can get yourself jabbed. And we appeal also, this call also goes out to everyone who has an elderly parent. Right? If you have an elderly parent who is not vaccinated yet, please engage them, persuade them to get vaccinated, bring them to the center to get them jabbed. You will be doing a lot to keep them safe. So don't take the view that, oh, it's okay, my elderly parent only stays at home, so not going out so much, it's all right. Because you may have people visiting your elderly parent, and any visitor may well bring the virus into the home. So please engage your parent, get them vaccinated as soon as possible. Finally, we will continue to synchronize our reopening plans with our vaccination rates. So this applies, as you heard just now, beyond 2/3 of people in Singapore fully vaccinated, we want to get higher. And we are also aiming for a much higher proportion of elderly persons being vaccinated. And as we achieve these targets, we will be able to progressively continue in a confident manner with our reopening plans over the coming weeks and months, and in the longer term, with our roadmap towards living with COVID normally. Thank you.
Thank you. I'll now invite questions from the media.
Thank you, Ministers and DMS. Dear members of the media, please be informed that the press release had been issued and that a final version will be sent later. We will now begin the Q&A segment. Members of the media, please remember to use the raise hand function on Zoom if you would like to ask a question, and a reminder to keep to one question per media only. If you are called upon, you will be prompted to unmute yourself, so please do so accordingly. May we have the first question from ST.
Hi, good afternoon, Ministers, DMS. Thanks for the briefing. A few days ago, we know that India declared this new Delta Plus variant, a variant of concern in India, and it's also been detected in Britain. So we'd like to know, have such cases been spotted in Singapore, and how concerned are we about this new variant? Thank you.
Thank you very much for the question. Just to clarify, the Delta variant is what is the viral variant of concern that's been acknowledged and categorized by the WHO. There have been several mutations that have been reported of this base Delta variant, of which there are at least two versions, and one version, the AY1 version, is associated with one particular mutation, K417N mutation, that's been reported mainly in Europe. A second version, which is called the AY2 variant, has been reported in various places, but mainly in the US. Neither of these variants have been reported in Singapore. We have not seen this so-called Delta Plus variant, and at this point in time, there's insufficient information to determine whether it should be categorized as a variant of interest or a variant of concern. But we will continue to monitor the situation. For every case that we diagnose, where possible, we will be carrying out phylogenetic studies and look out for the specific variant causing these infections, and we will certainly be on the lookout for any Delta Plus variant as it has been reported. But so far, this has not been seen in Singapore.
Next question.
Thank you, DMS. We'll now take the next question from Tzu Peng from Zhao Bao.
Hi, good afternoon, ministers and DMS. This is Zhi Peng from Zhao Bao. So Malaysia announced on Monday that Singapore might recognize their contact tracing app, My Sejahtera, as Malaysia's vaccination passport. So could the minister share some updates on the progress of these discussions? And also, since
Thank you,
Sinovac is not
Zhi Peng.
included... All right, thank you.
We continue conversations with all countries, as we repeatedly say. I think there's a lot of interest, whether it's Malaysia. Each time there is some news of one particular country, I can understand and appreciate the interest. These conversations continue, and as and when we have any updates, we will let people know what the updates are. But beyond the specific country sort of updates, we, as I said, are also separately working on guidelines for people in Singapore to travel. And those guidelines will be in due course issued, put out to the public, so that then you will know for different categories of countries, depending on their risk profiles, depending on how, the infection rates in these countries, potentially you will be able to travel there and come back, like I said, either without SHN at all or with a shortened SHN. So that's something that we are working on, and we will be putting out details in due course.
Just at a point, when you do something like launch an air travel corridor, whether for everyone or for vaccinated travelers, that's like taking an exam. So it's a big thing. But discussing, recognizing each other's digital certificate, that's just like doing homework, right? Just getting the homework done while envisioning that someday you may open up some form of air travel arrangement. Yeah, so I think all this homework should be done right now with as many partners as possible. Just getting the paperwork and the mutual recognition sorted out. Yeah.
Thank you, ministers. We will now take the next question from Jane Zhang, Mothership.
Hello, thank you all so much for the press conference. So I just want to check whether we have a target percentage that we're aiming for vaccination in order for us to achieve herd immunity or to explore kind of air travel, and how we plan on reaching higher vaccination rates other than outreach. If there's any other unconventional ideas, like some other countries have done kind of lottery things or winning certain items for us to achieve those higher vaccination rates. Thank you.
On the targets, we have announced what we can announce for now, and I think we have set something quite ambitious. Around National Day, 2/3 of our population being fully vaccinated. so that it will be the milestone that we are working towards. But as I mentioned just now, it's actually not enough. We need to go further than 2/3, especially given the transmissibility of Delta variant, and for the elderly, go even beyond that. So as to what kind of milestone will be tagged to what kind of opening and changes in shift in practices, I think it will be part of the roadmap that we are preparing and working out. But I would caution that there's still a lot of unknowns. And this enemy is full of curveballs, always thrown at us. So we are really crossing the river one stone at a time. Yeah. So right now, I think we know the steps. We know some of the milestones that we can achieve through our vaccination exercise, and how we now marry the two to come out with a viable roadmap. As for whether we should lottery, I think I asked my colleagues to talk about it.
Well, first, let me also elaborate on the point that for traveling, we have to bear in mind that it is not just our own local vaccination rate that matters. It is also important to take a look at countries where we have this traveling arrangement with. If they have a very high vaccination rate, of course, that gives us greater confidence to open up travel channels with them. If their cases are low and they are able to control the infection well, it also gives us greater confidence to open up with them. But if their vaccination coverage is low and their cases are still rising very rapidly, even if we have a very high vaccination rate, we need to continue to be careful in allowing travelers from that particular destination. So it's a multifaceted approach. It's not just single factor. We have to take into account several factors in deciding the level of vaccination that we need in order to open up to other countries. And we will have to take a differentiated approach depending on the different countries.
Just a final point, we will continue to do everything we can to ramp up vaccination rates, increase the take-up. I don't think at this stage we want to rule out any option, but as Minister Ong said, we do it step by step. So, as I mentioned, the next step, first of all, we are now having the vaccines available. We'll offer to everyone as soon as we can. Second step, we will talk about revised guidelines for vaccinated persons. We have not put those out yet, so we'll eventually, quite soon, have these revised guidelines, what vaccinated persons will be able to do within Singapore and how they can travel more freely. I think that in itself may encourage more people to be vaccinated, we hope. And then beyond that, we will see who are the remaining groups who still do not want to take the vaccine for whatever reasons, even after our persuasion, our volunteers calling up, and what other ways we can get them to take it up. It may not be simply a matter of monetary incentives. There could be other barriers that may be, impeding or causing them not to want to take up the vaccination. We need to understand better what their concerns are. So we are going to do this step by step, sequentially, and do our very best to get vaccination rates as high as possible.
Thank you, Ministers. We will now take the next question from Chen Lin, Reuters.
Hi, Ministers. So as communicated earlier, there are two vaccination milestones in Singapore. The first one, 2/3 of population fully vaccinated by August 9, and the second one is everyone by end of this year. So we would like to ask, what restrictions will be eased after this August milestone, and what will be eased further by year end when everyone is fully vaccinated? For example, can we actually expect that the revised public health guidelines for vaccinated person on social gathering by the August milestone? Yeah, thank you.
Well, you are really asking us what the roadmap is, which is work in progress and something we will be revealing or sharing in due course. You are absolutely right that, like we said, there is a milestone in National Day. But even before that, as I mentioned, we will look at the next stage of opening, because we still have to move to 5 persons potentially by mid-July, right? And that's something that we are watching, and we will consider whether or not when is the timeline for us to make that move to 5 persons for the higher risk activities. Beyond that, as I mentioned, we are looking at the guidelines for vaccinated persons, what can be done for vaccinated persons, both in Singapore and for travel. And then yet beyond that, there will be other easing potentially as we reach 2/3 fully vaccinated and provided our elderly population gets a very high level of vaccine coverage.
Just a clarification. We have not set any milestone for year end.
Yeah.
We've set one around National Day, 2/3 fully vaccinated.
Year end was what we had said before, that we will have the vaccines available to everyone by the end of the year, right? And as you can see with the bringing forward of supplies, we will be able to offer it to everyone well before the end of the year. The actual take-up, of course, depends not just on supplies, but on individuals themselves. And that's why we will continue to work hard at persuading everyone in Singapore to take up the vaccine.
I should add that we are also not saying that once we achieve a certain target, everything will be open and we are free to do everything. So it's not likely to be a big bang approach to opening. It will still be cautiously and progressively open, step by step, to ensure that we remain safe. Bearing in mind particularly, that's why we are so concerned about the vaccination rate among the seniors. Because today they are protected because of the safe distancing measures that we have put in place. So we have kept the transmission generally low because of these safe distancing measures. But once we are vaccinated, we have achieved a high level of vaccination, some of these safe distancing measures will then be eased off, so that we allow more activities to resume. But we have to be aware that once we allow more activities to resume, the risk will go up. Those who are vaccinated will continue to be protected by vaccination, but those who are not yet vaccinated, especially the seniors, actually they will face a higher risk of vaccination and higher risk of severe disease outcome as we remove these safe distancing measures. So that is why it is very important for us to encourage our seniors to get vaccinated, even as we plan towards opening progressively as our overall vaccination rate goes up. So we need to continue to press on with encouraging our seniors to get vaccinated so that they can be protected as we ease off the safe distancing measures.
Thank you, Ministers. May we have the next question from Christine, BBC.
Hello. I just, as you look at the reopening timeline, I just want to understand whether there were any economic factors or burdens or pressures that you are also looking at for Singapore, because it's been some time now. What benchmarks or factors or sectors are you considering, if so, in particular?
Yeah, I think economic consideration is a key factor as well. But currently, I think our focus is on public health to ensure that we are able to open safely. And vaccination is one key strategy towards that objective. But economic consideration is always important. As you pointed out, we have been restricted in many ways for quite a long time. Particularly, a lot of our projects, construction projects, are not able to proceed because of the lack of skilled workers. Many of them came from overseas sources. And we need to find a way to allow them to return to Singapore so that projects can proceed. And even our domestic helpers, domestic workers, we also need sources of these domestic workers to resume so that we can have these migrant workers to help our families. And there are a lot of export-oriented industries. They also have orders to fulfill. And many of these sectors are also under stress because they have limited access to manpower. And this is an area that we will need to look at how we can help them to resume their activities. Even domestically, with the safe distancing measures, some of the economic activities are still not able to resume fully. F&B sector is one. Hotel and tourism-related industries sector is another one. Some of these sectors will not be able to open until we are able to reach a high level of vaccination so that we are able to resume these activities safely. F&B, we probably will be able to resume to some extent when we allow cap of 5 persons to dine in. But of course, I know the F&B operators really hope that we can resume to at least 8 pax like what we had before in phase 3, or eventually allow 10 pax per table, or remove the limit if we can. So I think we have to move in that direction, but it all depends on the pace at which we can achieve a high level of vaccination. So vaccination is still the key to our opening of our economy.
Thank you, Minister. We will take the next question from Hui Min, Channel News Asia Digital.
Thanks for taking my question. So as we look towards preparing Singapore to, live with endemic COVID, has MOH been monitoring what's been called long COVID in other countries? So, monitoring earliest cases from 2020, and have there been any cases in Singapore? And are they of concern to MOH? Thank you.
Thank you very much for the question. Long COVID syndrome has been described in several different countries, and we still don't have a good firm grip in terms of what causes long COVID syndrome, how it manifests, and how we can address the degree of disability that some recovered cases have as a result of long COVID syndrome. NCID has been looking at this and has been following up all recovered cases in our public hospitals, and have also been trying to study this particular issue. I think they may be ready soon to provide further information on what the prevalence of long COVID syndrome is in Singapore. I don't have any specific information today that I can share with you, but when we have that available, we will let you know. This is one of the consequences of COVID-19 infection, and reinforces the concern that COVID-19 infection is not something just like a common seasonal flu. There are some patients who have severe outcomes, long permanent disabilities to some extent, and these adverse sequelae lasting for long periods of time is not something to underplay. There are also anecdotal reports have suggested that vaccination, interestingly enough, also provides some remedy from long COVID syndrome. Some long-standing sufferers of long COVID syndrome have reported improvement in the symptoms they experience after vaccination, and this may potentially be another reason to encourage even recovered cases to seek vaccination. But as more clinical information becomes available, we will try to bring this out to the media.
Thank you, DMS. We'll take the next question from Polling, Channel 8.
Hi, Ministers and DMS. Polling from Channel 8 News here. We see that the vaccination rate for most of the groups actually increased since the last update, except for the elderly group, which remains around 75%. Why is this so? I mean, despite us allowing seniors to actually walk in, and actually just now, Minister Wong mentioned that those above 70s are below 70% the rate. So why is this so, and how are you guys planning to reach out to them? We'll appreciate if we can get an answer in Chinese, because a lot of our elders actually are Chinese speaking. Thank you.
In Chinese 主要的原因是75%其实已经是相当可观的一个水平，但是还不够，因为年长者染上了这个冠状病毒，他们的这个病状会比较严重，所以他们的这个接种率要比年轻人高，所以75%还是不大足够，而且60岁以上的年长者。60以上是一个数目，70以上是一个比较低的数目，69%还不到70%，所以要增加。什么原因呢？一个是真的是怕麻烦，所以不懂得还是不想上网预约，所以就变成没有去接种了。所以现在能够直接走进联络所打疫苗呢，是对他们来说是一个非常方便的一个。步骤了，所以现在还是每天有大概600名年长者会直接走进联络所接种，这个也是很有意义，每20天就加1个百分点嘛，还是很有意义的。第二就是可能他们也 以前呢，因为有一些药物敏感或者食物敏感，而且被拒绝了，拒绝了过后就不敢去了，所以要说服老人家，现在没有这个限定了，即使是有食物或者药物的敏感，也可以继续的去接种疫苗。第三就是可能就听到有些人中风或者心脏病，结果变成不敢去打。这个我觉得有相当多的老人家有这么样的想法，但是我们的专家也研究过了，在没有冠状病毒之前，每年中风、心脏病总是会有，一年有好几千个，所以现在有打疫苗，这个中风跟心脏病的人数也没有增加，所以希望大家安心的去打。每一个疫苗都会有，每一种药都会有一些反效果，但是反效果这个的比率是非常低的，但是得到冠状病毒而引起非常严重的疾病，这个病率是相当高的，所以比一比还是接种疫苗比较妥当。所以希望大家年长者、老人家、阿公阿嬷们，去打疫苗吧。如果还担心的话，就打那个电话，1800-333-9999，很容易记，你看我都记得了。所以还是跟朋友交谈一下，跟家人讨论一下，壮壮胆，敢去打疫苗吧。
想老人家他们的顾虑是会有很多方面的。一方面他们可能会觉得自己反正很少出门，所以没有什么必要去打这个预防针因为染病的机会也不高但是我想跟大家分享的就是，虽然他们自己可能没有出门，少出门，但是他的家人还是常常出门的，他们还是会把这个病菌带回家，他们跟儿孙在一起的时候也会受到感染，所以这个风险还是存在的。就像刚才我所解释的，当我们开始解封的时候呢，这个病例可能会增加，但是因为大多数的人都已经接种疫苗了，所以他们都得到保护。但是相对的来讲，这些年长的还没有接种疫苗的呢，他们的风险就会提高的。所以我还是想鼓励大家尽早的去接种这个疫苗。如果大家有疑问的话，可以询问你的医生，或者是询问我们的热线服务，我们会为您解答你心中的疑问。那么最终这个疫苗还是对大家产生了非常重要的保护的功效，所以是希望年长者尽早去接种这个疫苗。
Thank you, Ministers. We will have the next question from Atia Berita Harian.
Hi, Ministers and DMS. Earlier, Minister Gan mentioned about allowing migrant workers coming back to Singapore. Will there be extra precautions or measures that will be taken to ensure that there won't be sudden spike or things like that? And how will this also change when we go on the endemic path?
Thank you. I think you are right that in fact MOM, Ministry of Manpower, Ministry of Trade and Industry and the various ministries are working together to continue to strengthen our precautionary measures with regard to migrant workers, both at the entry point as they enter Singapore, the process of the stay-home notice that they serve, as well as safety precautions at the dormitory, as well as the workplaces. We continue to enhance these measures to ensure they are able to arrive safely, stay in the dormitory safely, even in the community. Some of them stay in the community, do so safely, and they are able to go back to work in a safe way. So these are measures that will continue to enhance, improve over time. And as other countries, source countries, vaccination also goes up. And if they are able to continue to control and manage their infection in these countries, I think we will also be able to increase the number of migrant workers that are allowed to come in. So we are also working with the source country to introduce measures at the source country level to prevent the importation of COVID-19 cases. So I think we need to take a multi-pronged approach to ensure that we are able to open the border for more migrant workers to arrive safely, and this is very critical for our economic activities to resume.
Thank you, Minister. We will now take the next question from Hui Jie, The Edge.
Hi, Ministers, DMS. I wanted to simply ask that we have some anecdotal stories for the younger group of people going for the Pfizer vaccine instead of the Moderna vaccine because of the side effects. I would like to ask, have the MTF actually seen any of these trends, and any measures does it intend to convince people that it is actually still the same?
Thank you very much for your question. You're asking about more people opting for the Pfizer vaccine compared to the Moderna vaccine, and whether or not we've actually tracked adverse effect rates to determine whether or not they are any different. We have been looking at adverse events for all the vaccines that we've been administering, and that would be both the Pfizer as well as the Moderna vaccines. And at this point in time, we've not picked up any signal that suggests there's a higher overall adverse event rate associated with the Moderna vaccines compared to the Pfizer vaccine. So effectively, they're both the same as far as efficacy is concerned, as well as the adverse effect or side effect profile. And we have therefore been encouraging all to get vaccinated with whatever vaccine is available. Given that our vaccines were coming in different batches at different points in time, we previously had either the Pfizer vaccine being more readily available, and at other times the Moderna vaccine is more readily available. And our message has always been that whatever vaccine is available, please feel free to register and take up these vaccines. Neither vaccine is necessarily better than the other. There are specific indications and contraindications that are different. For example, now as we extend vaccinations to the younger people, we're using exclusively the Pfizer vaccine, simply because the Pfizer vaccine has been approved for use in children between the ages of 12 and 18. Whereas the Moderna vaccine currently is still registered for use in individuals above the age of 18. So other than these regulatory restrictions, there is no significant difference between the Pfizer and Moderna vaccines. And whatever vaccine is available, I would encourage all who are able to register, then to register for either vaccine.
Thank you, DMS. We'll take the 10th question of this afternoon from Xue Mei, CCTV.
Hi, Minister. I just checked because during the past 2 weeks, Hong Kong, the case is very low, even though they're low. Do you think it's possible to allow the Hong Kong travelers to Singapore no need to quarantine even without the bubble travel? Thank you.
So we have a framework today already, as you know, that allows, that categorizes countries according to their risk, their infection rates. And for the countries where the infection rates are very low, comparable or even lower than where Singapore is, and situation is well under control, we do allow the travelers from these places to come to Singapore without SHN. That framework is in place. We continue to review, update the countries because the situation is so fluid and dynamic. Sometimes countries that are in this category may drop down, and then you will impose SHN. Sometimes countries that are, or places that are not in this category, the situation improves, and as it improves over time, we will so-called upgrade it to this the low-risk category, where then they will be allowed to travel into Singapore without SHN. So we will provide updates in due course.
Thank you, Minister. We will now take the last 2 questions of this afternoon. May we take the penultimate question from Song Lin, SMDN.
Oh, hi, Ministers. Okay, so I understand that the Bukit Merah cluster has also led to a lot of like secondary infections. So, is it possible to maybe comment on the rate of how you guys are actually containing it right now?
I'm not quite sure what you mean by rate, but certainly we've been working very hard to limit the further spread of COVID-19 infection within the area of Bukit Merah, extending on into the Tiong Bahru area on the east side and the Red Hill area on the west side. Our testing has been guided by where the cases are, and when we map out where the areas of where people move to, movement tracing and activity mapping, we've also extended very strategically the boundaries of our testing to include these areas in order to ensure that we've not also missed out various nexus of activity that may be contributing towards cryptic spread. We've been using wastewater testing as a sentinel surveillance to pick up where possibly further cryptic transmission may lie, and have been directing some of our testing operations accordingly. And this has allowed us then to extend our testing envelope to include areas, for example, in the greater Bukit Merah area, extending to the Red Hill area as well. And we will continue to look at all these signals to determine whether there are areas where we have missed and where we need to continue to be very vigilant on. Not only are we testing close contacts, but in these areas where we want to exclude cryptic spread, we've also made it available to all well worried in these areas to step forward, and where the signal is much stronger, supported by multiple cases or even the wastewater test signals, we've made it mandatory for residents in specific blocks within these areas to step forward for testing, and we made testing very available. We are studying further strategies, how we can make testing more accessible for all in this area, and when our plans mature, we'll make these announcements in due course.
Thank you, DMS. Can we have the final question from Yu Jin today?
Hi. So right now it seems like our demand for vaccines exceeds supply, but does the task force anticipate that the rate of vaccination might plateau at some point? And also, will households with unvaccinated members live, how would they live in a new normal? Will these unvaccinated individuals be at a disadvantage? So for instance, they won't be able to attend certain events, or they have to undergo for more routine testing. And the last question is, will
Thank
booster
you,
vaccines in
Eugene.
the future be
I think the laws of demand and supply must mean that as we vaccinate 80,000 doses, we administer 80,000 doses a day from this weekend onwards, there will come a point in time that the supply keep increasing, the demand keep being met, and then at some point, instead of demand more than supply, the situation will flip, right? And that is something that we are working towards. And at that point, of course, you will have something that's asymptotical, and you find that and we are seeing that amongst the elderly, where after 75%, you find the last 25% is harder to get to. And I think this will happen at some level, once we reach a certain level for the rest of the population. And as Minister Lawrence Wong mentioned, we will have to work out some form of norms where certain activities, if you are vaccinated, you can take part. If you are not, maybe you need a test. And other travel benefits as well. If you are vaccinated, we know that more likely you are protected. You're not likely to be infected and pass an infection to others. And likewise, then therefore, from public health point of view, it will make sense to start to have some differentiation and as we reach an endemic stage, which is what Minister Wong talked about just now.
I think as we press ahead with our vaccination program, at some point the vaccination rate will plateau off. We hope that it will plateau off at a very high level so that the bulk of Singaporeans would have been vaccinated and protected, rather than to plateau off at a lower level. Again, as I said, our particular concern is among the seniors. We hope that it will continue to climb. And so far, since the last we have announced walk-in vaccination without having to register, we have seen an increase in the number of seniors stepping forward to get vaccinated. I think we hope to continue to do so, and we also plan for additional outreach programs and efforts to reach out to these seniors to encourage them to come forward to be tested. And I urge our fellow Singaporeans to also, especially our family members, encourage our senior family members to also get vaccinated. And this way we will be able to ensure a high vaccination rate among our senior population. This will provide them with the necessary protection, especially as we progress to gradually open up our economy and our community. This will ensure that they will continue to be safe even as we move into an endemic situation.